So I have my stained and dried blood smear. So I'm going to start on the 10 objective, turn the light down a little bit. And so when you're using the 10 objective, you're looking for any significant large objects, like for example the microfilaria of heartworm. Okay, so scan that. Don't see anything. Everything looks normal. So then switch to high dry. We don't have 40, so I use 20. And refocus. Turn the light up a tiny bit. And make sure that it's stained properly. You can make sure everything is distributed normally. There's a normal amount of red and white blood cells. Just check and make sure that the smear is good quality so that you can get an accurate numbers. And then go to the 100 objective with the immersion oil. And so you can turn the light up all the way for this. Refocus. And then find the monolayer. Alright, so now that I found the monolayer, I'll go ahead and start my counts. So I'm going to count 100 white blood cells, and I'm going to look for any abnormal red blood cells, white blood cells, and platelets, and also do a platelet estimate. These are my findings. Neutrophils, 73%. I didn't see any eosinophils. I saw 1 basophil, 8% monocytes, 1% basophils, and 17% lymphocytes. I didn't see any abnormalities in the red blood cells, white blood cells, or the platelets. There was normal rouleau, and there was crenation of some of the red blood cells. That's an artifact. And the platelet estimate is 12 per field. This can mean some different things. For neutrophils, it can indicate cancer or inflammation, and banned neutrophils can indicate infection. Increased basophils are rare, but that can indicate cancer, inflammation, and infection. Increased eosinophils can indicate a parasitic infestation or allergic reactions. Increased monocytes can indicate inflammation, and increased lymphocytes can be caused by excitement or leukemia or Ehrlichia infection. Okay, so I'm going to get my saline to moisten my swab. Moisten both of my swabs. So, just gently roll the Q-tip to collect the cells. Right ear, so put it on the right side. Left ear. Fourth. Okay, so now wave it in the air to dry it. Briefly flame bottom. And then do my dip quick stain. Dry, but side down. Now that the slide is dry, Start on the thin objective. Look for anything big that's abnormal. See anything. So we don't have a 40, so the next high dry is 20. Focus. And adjust the light as needed. And just looking for anything abnormal, large. And here's my immersion oil. 100 objective. And so this is where you'll see yeast, bacteria, and things like that. If there's infection, you can see some white blood cells. And I'm not seeing anything. This is the setting you'd want to use the brightest light. Seeing occasional yeast. And you would examine the other side and compare and note anything in the record and let the doctor know. So the most common things seen on ear cytologies are yeast and rods and cocci. And sometimes if the infection is bad, you'll also see neutrophils. Alright, so I'm going to get my saline or my Q-tip. My saline on my Q-tip. Use an ear cone as a speculum. And then you put the Q-tip in and roll it gently to collect the sample. Okay. Then roll it onto my slide. And then wait for it to dry and then I'll stain it. So I air dry the slide by waving it in the air, and then once it's dry. So now I'm going to stain it. My dip quick.
Did you still need to find out what the email address that we're sending from?
No, I found out and then we're good. Oh.
And then rinse it. Okay, so now my slide is dry. So I'm going to start on the 10 objective. Get that in focus. So there isn't anything large you can see that's abnormal. Don't see anything.
Yep. Okay.
Switch it over. We don't have a 40, so the high dry that I would use would be the 20. And then refocus it. Scan some more. So when I go to the 100 objective, put my immersion oil on the slide. Switch over to the 100.
Yeah.
Focus again.
One more time. Take a point. There's one more substance, right? So we should get that one more time.
And so now you're really able to see the different kinds of cells. And so the cells, most of the cells that I'm seeing are just intermediate. So you have the parabasal, which you see during anestrus, and then the intermediates can all look like this. They start out, smaller, and then they kind of spread out as they become older cells, and then they eventually lose their nucleus and become cornified epithelial cells. And this is what you're looking for when you do a vaginal smear and you're checking to see if the pet is ready to be bred, because when they're in estrus, all the skin cells are going to be the cornified epithelial cells. And so that's when you know that the patient is ready to be bred. Okay, so this is the urine that I collected, and gross examination, it's light yellow, so the color is normal. It's clear, you can read through it. The owner didn't report any abnormal increase in the amount of urination, and on the ultrasound the bladder looked like a normal size. There isn't any foam. Normal odor. Okay, so I'm going to get some urine for the specific gravity.
Oh, I'm supposed to call it.
Okay, so the urine specific gravity is 1.020. And I'll take
Thank
my
you.
lens paper and
I
my
did the chart and
distilled
stuff,
water
yeah, I
to
forgot it.
clean it. And gather my urine for the Regent strip. Okay, so I'm going to make sure that each square is pretty well saturated. And you can just tip it to get any excess off, and then wait 1 minute, and then I will read the results. Okay, so I've waited a minute, and then I read my Regent strip using the container, and the pH was 8, glucose was negative, there was some trace protein found, negative on the ketones in the bilirubin, and negative on the occult blood. Okay, so I'm going to centrifuge my urine, and I have my balance, and I will centrifuge that for about 5 minutes. Okay, so I spun down my urine. So now I'm going to pour off most of the liquid on the top. Just a little bit of liquid, and then flick it to resuspend the sediment. And then I'm going to take a little sample. Put it on the slide. And then put a drop of city stain. And put my cover slip. Make sure I don't make a big mess. Okay. And we don't have a 40 objective, so I'm going to start on the 20. And I'm going to look for casts and crystals and large cells. And then I'll switch it over to the 50 so that I can look for bacteria. Okay, so after evaluating the sediments, I only found one hyaline cast. I didn't find any crystals or bacteria, and I did see one neutrophil, so pretty healthy urine. And so here are some of the crystals. So struvite's really common. You've got the calcium oxalate, cysteine, and the urate, so the crystals in the stones. And you can also find white blood cells, red blood cell casts, bacteria. And so examples of the casts. Hyaline are really common. Then you have granular. And then you have white blood cells, red blood cells. The waxy casts just are kind of gray and they look pretty transparent, and then some have the little fat cells in there, and then you can also see mucus threads.